Let us check the topic of a very important subject, and that is classical or radiological science of case of chronic osteomyelitis, which is very often asked in the long case, in the short case, OSCE, MEQ, and sometimes in MCQ as well. And this is very important for all the medical students and doctors to know about chronic osteomyelitis management in hospital practices. So what are the classical radiological findings that we must look when we are given an X-ray of a case of osteomyelitis? These are the following: increased bone resorption, multiple cavity formation, new bone formation subperiosteally and in the endosteum as well, the cortical irregularities, formation of a sequestra or sequestrum, involucrum formation, cloaca formation, and the cortex is usually expanded, and there will be irregular patches of sclerosis and lucensis, and there will be cortical destruction due to osteolysis. So one by one we will take up and see what they are. The multiple cavity formation. You can see here, these are the cavities, and here we can see there is a sequestrum as well. And many times when there is a cavity which is pouring the pus outside the skin, there will be sinus formation. And when there is a sinus, we can do the sinogram to locate the position of the sinus which is going inside the bone and how much bigger is the cavity. This is a case of sinogram. The sequestrum and the involucrum, you can see it. This part of the shaft, upper part of the shaft of the humerus, has sequestrated or it has become dead. And once it becomes dead, the pus has come subperiosteally and periosteum is elevated. And once the periosteum is elevated, it reacts by formation of new bone. And so new bone is being formed. This is the new bone which we are seeing on the X-ray. And this new bone is called involucrum. Inside there is a sequestrum, which is a dead bone, and outside new bone formation which is happening is involucrum. Here we can see the sequestrum, a lying separate bone which is dead and separated from the parent bone. So we can see it here, the whole of the shaft of the femur, probably whatever we can see in all the part of the X-ray, this is dead. So this dead part of the shaft, it is called sequestrum, and over it there is a bone which is formed, and this new bone which is formed outside the sequestrum is called involucrum. You can see it here again. There is a sequestrum which is lying down in the cavity filled with pus. So in this X-ray we can see that we have already seen in the first one, there is multiple cavities, there is a sequestrum, irregular patches of sclerosis and lucensis. You can see the lucency and then sclerosis, and the cortex is expanded. Here is a case of the chronic osteomyelitis of the femur with intermittent drainage over a period of 40 years. See the long duration where the chronic osteomyelitis can persist. Again, on the X-rays, we are seeing the cortex is expanded. There is irregular patches of lucensis and sclerosis, and is present in the almost whole of the diaphysis. This is the case of a 6-year-old girl which the girl has no history of trauma and she presents with the pain and swelling in her right knee. Now in the radiograph, which is the AP view, you can see there is a well circumscribed lucent lesion and there is a sclerotic margins, which gives a suspicion of this cavity full of pus. So this is how we'll be seeing it. The involucrum, which is outside, and sequestrum, a dead bone inside. Here again, whole of the shaft almost sequestrated. Here again, sequestrum, you can see it, and then new bone formation outside, which is forming a new cortex. So again, sequestrum and involucrum is outside new bone formation. Thank you very much. Thank you.